Hi, hi everyone. And I will explain in brief about multi-ligament injuries. So we have talked a lot about ACL, PCL, meniscus, and other ligament injuries of the knee. Sometimes what happens, we face patients having multiple ligament injuries of knee. So usually this happens because of high velocity, high injury trauma, which leads to injury of two or more than two ligaments. So what is multi-ligament injury? Multi-ligament injury is when your two or more than two ligaments get torn, and that needs further management. It may be 2 ligament, 3 ligament, 4 ligament. It may be associated with your knee dislocation, and sometimes it may be associated with your ligament injury, knee dislocation, and some sort of fractures also. And it may be that severe also. So as we as orthopedic surgeons, we are always apprehensive and anxious in getting these cases. After we get these cases, it becomes really a nightmare for the patients and for the surgeons also, because starting from the diagnosis, then planning of management, execution of planning, that is surgery, and the rehab protocol, everything is very, it's complicated, and having a lot of debates. And every step needs a lot of dedication, discipline, and planning from surgeon's perspective as well as from patient's side also. So what happens? We classify these injuries into 5 categories. In class 1 category, you may have ACL injury or PCL injury. Along with that, you will have some sort of your knee, other ligament injury, maybe lateral side of knee or outer side of knee ligament injury, and or maybe medial side of knee injury. So we have already talked about lateral ligaments are lateral collateral ligaments, medial ligaments are medial collateral ligament. We have talked about ACL and PCL, and there are corners of the knee. So we call them dark corners of the knee. So lateral side is posterolateral corner, and medial side is or inner side is a posteromedial corner. So it's a difficult thing. It's not for the common people only. It's for my residents, my fellows, and practicing orthopedic surgeons also. I want to make the things very clear and understandable. So what happens in grade 1? Only ACL or PCL plus one of the inner ligaments or outer ligaments or corner ligaments injury. In class 2, a grade 2 injury, your both ACL and PCL ligaments are torn. In grade 3, what happens? Your ACL and PCL, or maybe plus lateral side of the knee ligaments are torn, which is known as grade 3L. And in case of grade 3M, your ACL plus PCL and associated with that, your medial side structures or inner side ligaments are torn. In grade 4, it's all torn. No ligament is left intact. So ACL, PCL, lateral side, medial side, lateral corner, posterolateral corner, medial corner, all are torn. So this comes under grade 4. And the grade 5 is the most dangerous type of injury of the knee, and which includes all the ligaments are torn, your knee is dislocated, and along with that there may be some sort of periarticular fractures also. So you can imagine what happens if your knee gets dislocated, there are fractures, no ligament is left intact. So that is most devastating orthopedic injury, one of the most devastating orthopedic injury. So now coming to diagnosis and management. Once we receive the patient in emergency, so our challenges start from there only. So first we see whether your distal structures like your blood flow is all right or not, your nerves are working or not. If your nerves are not working, we call it neurological injury. So there may be common cranial nerve injury. If your vessels are, blood flow is not good, then we call it vascular injury. So these are very, very devastating and very dangerous injuries, may be associated with nerve injury or vessel injury or both. And in these cases, sometimes the limb may be in danger. Sometimes it's difficult to even, salvage the limb also. So how do we confirm that? We confirm that vascular injury by doing peripheral Doppler studies, peripheral CT angio study, and peripheral color Doppler study also. We do a lot of tests. We palpate the distal pulsation. We palpate other, popliteal artery pulsation, tibialis posterior pulsation, arteria dorsalis pedis pulsation. We examine for neurological intactness. There are multiple tests for that. We see ankle brachial index also, and there are a lot many tests we perform. We look for any compartment syndrome of your leg where the total pressure of the leg compartments gets drastically increased, and in that case it may lead to compartment syndrome, which is again a very dangerous situation in these cases. So after clinical examination, we try to reduce your knee if it's dislocated. Otherwise, if it's not dislocated, we start further workup. And as a part of the workup, we do CT scan of your knee to look for any bony injury. We do MRI of the knee also. And according to the findings of the CT and MRI, we further plan. If it's more than 3 or 4 ligament injury, then we plan surgery in stages also. So there are options that in one go we may operate. Otherwise, if the local area is hugely swollen, skin condition is not good, and patient is not fit for surgery and not fit to withstand 3-4 hours of surgery in one go, then we plan stage surgery also. And if we plan stage surgery, then we do immobilization by either applying a plaster slab or by applying X-fix, especially if the knee is dislocated after reduction of the dislocation. And we wait for a few days, preferably up to 2 to 3 weeks, and then we go for as per planning. In stage 1 surgery, we do reconstruction and repair of all the ligaments whichever is torn, and in stage surgery we reconstruct oblique, or maybe sometimes we repair some of the ligaments also. So in staged manner in 2 surgeries. So overall, we need. I think this is too elaborate discussion about multi-ligament injury, but after routine discussion of the routine stuff in orthopedics, I was thinking of to come up with some rare and some elaborate discussion about something, and that's why I decided to talk on multi-ligament injuries also. So it's a very, very huge topic, and for my colleagues, my residents, juniors, fellows, and as well as for the patient also. It's not theoretical only, it's all we get routinely in our daily practice. But because this is a video for the common people, I will restrict myself to this point only, and if someone wants to know more about these sort of extremely dangerous injuries, I can make another video to explain it in more details. So till then, take care of your being, take care of yourself, be happy, be healthy, and enjoy your life. Thank you.